Hey everyone, I'm Natalie from Mile 2, and today we're talking about health insurance. In 2024, Mile 2 made the switch from traditional medical insurance to Sidecar Health. This decision was based on employee feedback, pay transparency, cost, and doctor-led care. In the next few minutes, we'll go over what it is, how it's different, and how it works for you. Sidecar is an innovative approach to health insurance built on the power of cash prices and pay transparency. You can shop for healthcare anywhere that takes cash and even save money on out-of-pocket medical expenses. Instead of an ID card, you'll get a Sidecar Visa to pay for your care on the spot. With traditional plans, you're limited to the insurance carrier's network. With Sidecar, there is no network. That means you can go to any doctor, facility, or pharmacy that you'd like. With Sidecar, you won't need to obtain prior authorizations, there are no restrictive drug formularies, and you'll have access to mental health providers that don't accept traditional insurance. With Sidecar, our employees are never responsible for surprise bills from the emergency room, and will never get a surprise bill for unplanned services that occurred during planned procedures. Sidecar's member care is available 7 days a week by phone or chat, and 99% of calls are answered in under 10 seconds by a real human with real answers. No phone mazes. Our Sidecar plans are ACA compliant, so there are no exclusions for pre-existing conditions, and preventive care is covered at no cost when you see a doctor who charges at or below the benefit amount. What is a benefit amount? It's the key to shopping for care. Before you purchase any service, you'll want to look up your benefit amount, which is the exact amount your plan pays for covered care. Here's a few key things to know about benefit amounts. They're based on the average prices that providers are charging in your area. When you see providers who charge less than your benefit amount, you keep the savings. If you see a provider who charges more than your benefit amount, you pay the difference. If you can't find a provider at the benefit amount, just reach out to Sidecar's member care team and they will help you find one, or they will raise your benefit amount. This is Sidecar's guarantee. If you love your provider and they're worth a higher than average price to you, you don't have to change providers, but you will have to pay the difference between their price and your benefit amount. If it's more important to you to find care within the benefit amount, you're encouraged to call providers and ask for their cash price. The choice is yours. So the big takeaway here, instead of asking, are you in network? The question you'll be asking is, what is your cash price? Now let's review our specific plan details. At Mile 2, we offer 2 plan options, a $0 copay plan and an HSA compatible plan. On the $0 copay plan, once you've met your annual deductible, you're not responsible for any covered medical expenses as long as you continue to shop for care at or below your benefit amount. Also, many services on this plan are covered before you meet your deductible, such as primary care, telehealth, and prescription drugs. So, how can you earn savings on this plan? If you shop for care and find services or prescriptions below your benefit amount, you bank the difference. This bank of savings can be used throughout the year to cover any expenses you might have that are over the benefit amount. If you still have savings at the end of the year, that money will be returned to you via payroll. Now let's look at the HSA plan. This plan will cost you less out of your paycheck, but the deductible is higher. It comes with a health savings account that Mile 2 contributes to. Like the copay plan, once you meet your annual deductible, you are not responsible for any covered medical expenses as long as you continue to shop for care at or below your benefit amount. Aside from preventive care, all covered expenses are subject to the deductible. Don't forget about prescription discount programs like GoodRx and Cost Plus drugs. With traditional insurance, it was difficult and even discouraged to take advantage of these savings. But with Sidecar, finding the best deal will earn you money if it's below the benefit amount. To sum it up, Sidecar is different, and they're changing the way people access healthcare, interact with their providers, and pay for services. It'll take some getting used to, but we're here to help, and so is Sidecar. We hope that employees enjoy the control that Sidecar gives to its members, as well as the potential to see significant savings when it comes to medical care.